Hi friends, welcome back to today's video. Today we will discuss NCLEX question papers with rationale. It will be useful for all nursing exams like staff nurse exam, nursing tutor exams. So we will see question number 51. A client is admitted to the labor and delivery unit in active labor. During examination, the nurse notes popular lesions on the perineum. Which initial action is most appropriate? Options are document the findings, report the findings to the doctor, prepare the client for a cesarean section, continue primary care as prescribed. Correct answer option B. Report the findings to the doctor. We will see the rationale. Explanation. Any lesion should be reported to the doctor. This can indicate a herpes lesion. Clients with open lesions related to herpes are delivered by cesarean section because there is a possibility of transmission of the infection to the fetus with direct contact to the lesions. It is not enough to document the finding, so answer A is incorrect. The physician must make the decision to perform a C section, making answer C incorrect. It is not enough to continue primary care, so answer D is incorrect. Next question. A client with a diagnosis of HPV is at risk for which of the following? Options are Hodgkin's lymphoma, cervical cancer, multiple myeloma, ovarian cancer. Correct answer option B, cervical cancer. Explanation. The client with HPV is at higher risk for cervical and vaginal cancer related to this STI. She is not at higher risk for the other cancers mentioned in answers A, C and D. So those are incorrect. Next question. During the initial interview, the client reports that she has a lesion on the perineum. Further investigation reveals a small blister on the vulva that is painful to touch. The nurse is aware that the most likely source of the lesion is options are syphilis, herpes, gonorrhea, candylomata. Correct answer option B, herpes. Explanation. A lesion that is painful is most likely a herpetic lesion. A cankry lesion associated with syphilis is not painful, so answer A is incorrect. Condylomata lesions are painless warts, so answer D is incorrect. In answer C, gonorrhea does not present as a lesion but is exhibited by a yellow discharge. Question number 54. A client visiting a family planning clinic is suspected of having an STI. The best diagnostic test for Treponema pallidum is options are Venereal Disease Research Lab, Rapid Plasma Reagent, Fluorescent Treponemal Antibody, Tire-Martin culture. Correct answer option C, Fluorescent Treponemal Antibody. Explanation. Fluorescent treponemal antibody is a test for Treponema pallidum. VDRL and RPR are screening tests done for syphilis. So answers A and B are incorrect. The Tire-Martin culture is done for gonorrhea. So answer D is incorrect. Question number 55. A 15-year-old primigravida is admitted with a tentative diagnosis of HELP syndrome. Which laboratory finding is associated with HELP syndrome? Options are elevated blood glucose, elevated platelet count, elevated creatinine clearance, elevated hepatic enzyme. Correct answer option D, elevated hepatic enzymes. Explanation. The criteria for HELP syndrome is hemolysis, elevated liver enzyme and low platelet count. In answer A, an elevated blood glucose level is not associated with HELP. Platelets are decreased, not elevated, in HELP syndrome as stated in answer B. The creatinine levels are elevated in renal disease and are not associated with HELP syndrome. So answer C is incorrect. Question number 56. The nurse is assessing the deep tendon reflexes of a client with preeclampsia. Which method is used to elicit the biceps reflex? Options are: a nurse places her thumb on the muscle insert in the antecubital space and taps the thumb briskly with the reflex hammer. The nurse loosely suspends the client's arm in an open hand while tapping the back of the client's elbow. Correct answer option A. A nurse places her thumb on the muscles inset in the antecubital space and taps the thumb briskly with the reflex hammer. Explanation: answer B elicits the triceps reflex, so it is incorrect. Answer C elicits the patellar reflex, making it incorrect. Answer D elicits the radial nerve, so it is incorrect. Question number 57. A primigravida with diabetes is admitted to the labor and delivery unit at 34 weeks gestation. Which doctor's order should the nurse question? Options are: magnesium sulfate 4 gram 25% IV, Breathin 10 mcg IV, Stadol 1 mg IV push every 4 hours as needed PRN for pain, and Ansef 2 gram IV PB every 6 hours. Correct answer option B, Breathin 10 mcg IV. Explanation: Breathin is used cautiously because it raises the blood glucose level. Answers A, C, and D are all medications that are commonly used in the diabetic line, so they are incorrect. Question number 58. A diabetic multigravida is scheduled for an amniocentesis at 32 weeks gestation to determine the LS ratio and phosphatidylglycerol level. The L-bar-S ratio is 1 is to 1 and the presence of phosphatidylglycerol is noted. The nurse's assessment of this data is: options are: the infant is at low risk for congenital anomalies, the infant is at high risk for intrauterine growth retardation, the infant is at high risk for respiratory distress syndrome, the infant is at high risk for birth trauma. Correct answer option C. The infant is at high risk for respiratory distress syndrome. We will see the explanation. When the L-bar-S ratio reaches 2 is to 1, the lungs are considered to be mature. The infant will most likely be small for gestational age and will not be at risk for birth trauma. So answer D is incorrect. The L-bar-S ratio does not indicate congenital anomalies as stated in answer A, and the infant is not at risk for intrauterine growth retardation. We will see question number 59. Which observation in the newborn of a diabetic mother would require immediate nursing intervention? Options are: crying, wakefulness, jitteriness, yawning. Correct answer option C, jitteriness. Explanation: jitteriness is a sign of seizure in the neonate. Crying, wakefulness, and yawning are expected in the newborn. So answers A, B, and D are incorrect. Question number 60. The nurse caring for a client receiving intravenous magnesium sulfate must closely observe for side effects associated with drug therapy. An expected side effect of magnesium sulfate is: options are: decreased urinary output, hypersomnolence, absence of knee jerk reflex, decreased respiratory rate. Correct answer option B, hypersomnolence. Explanation: the client is expected to become sleepy, have hot flashes, and be lethargic. A decreasing urinary output, absence of the knee-jerk reflex, and decreased respirations indicate toxicity. So answers A, C, and D are incorrect. Thank you for watching my video. If you are interested, please subscribe my channel and press the bell icon also. You will get a lot of question papers, various central and state government exams. Please support me by watching all the videos and please subscribe. Thank you.